Hello, welcome to our Friday webinar. We are on with Dr. Lamb. Dr. Lamb, welcome. We're going to do
Hello.
a fabulous discussion on what's our topic today?
Chlamydiosis or
Chlamydia. Or
psittacosis or all the other names that it goes by.
okay. I mean, I guess most people, I think psittacosis is like the word that we probably heard the most associated like with this topic, right? But
Yeah.
chlamydiosis is okay. Well, I'm glad that you cleared that because I would have been confused. No, I'm just kidding. Um, let's see. So we've got. I'm sure this is. I mean, this I can't think. This is like. What do you say? This is like a top three, like big. If you were gonna do a top three conditions or diseases you should know about, would this be kind of near there?
Yeah, this is definitely at the top. And, when we were trying to come up with, what's the next webinar going to be? We were talking about it and we're like, wait a second, we haven't even talked about chlamydia yet. That's crazy that we haven't talked about this particular disease. It's kind of blows my mind that we forgot to talk about it.
Okay, well, we're doing it today, so there we go. And if you're just joining us, the login, tell us where you're coming from, what city, and we'll maybe have time for questions at the end. And if you do, we'll use the Q&A button, not chat button, for those questions. So I know this might be like it's a disease condition topic. So we're gonna start with something a little bit lighthearted. We got this. I'm gonna do a real quick screen share. Hopefully, bird people will, our bird parents here will. Oh, I gotta. Sorry, let me try that again. Move up my screen. There we go. Okay. Someone, Tig, Tig's mom, Tig the cockatiel, mom shared this with us on, you want a bird, what your expectation is, and sometimes what your reality is kind of, I think it's kind of spot on with, this is adorable. Um, yeah, like all the dander, who can relate to that? Like the bottom half of the cartoon is just really funny. It is like just soak that in a little bit. Yeah.
Yeah, I like the one with the poops on the back of the computer screen there.
Oh my gosh. Yes. There's probably we should create a bird specific product for that, for cleaning bird poop off of your electronics. Um,
Right.
yeah. And then the messy, of course, that's their artwork, loud. I just love it all. Like the look when sometimes you're eating something they shouldn't eat, but they are giving you the darts, like, why am I not getting that a piece of that?
Yeah.
And then anyway, oh my gosh. Okay. So that's my cute share for the day. Thank you for sharing that with us, Tig's mom. Appreciate it. That was a good way to start. Okay, there we go. I'm
All
gonna let
right.
you go
You ready
because you
for me to
have a
start?
fabulous PowerPoint for us. So,
Yep. All right. Let me go ahead and share my screen. All right. And let me get the slideshow going. All right. So thanks everybody for coming today so we can talk about this important topic. Again, like I was saying, I'm surprised that we kind of hadn't really focused on it specifically. It is something that's so important and something I definitely talk with owners about a lot. And we absolutely have talked about it in other webinars, but it's been a part of other webinars. Like we've talked about it briefly when we've talked about respiratory problems, when we've talked about eye problems, when we have talked about neurologic problems or liver problems. We've talked about it many times, but not sat and focused specifically on this particular disease. So today is going to be fully focused on it so that we can learn more specifically about what it does, how it causes problems, what a veterinarian is looking for with this particular disease when they're diagnosing it or trying to see could this be what's causing the problem, um, and much more. And of course, at the end, I'm happy to answer any questions that anybody has. But so first thing is, what is chlamydiosis? Well, chlamydiosis, the definition would be the disease that's caused by the bacterial organism Chlamydia psittaci. So it is a bacterial organism. Chlamydia is the genus, the species is psittaci. When I talk with owners about it, I may use just the shorthand term chlamydia. And of course, when I say I'm worried your bird could have chlamydia, I would say probably like 75% of the time owners are suddenly in shock because they know the word chlamydia associated with other things in humans. But this is a different organism. This is Chlamydia psittaci. And as you can see by the species name, psittaci, that means psittacine, right? Our parrots. It is something that was kind of originally found to be associated with parrots. It is a gram-negative intracellular obligate bacterium. So this picture that I have here, this is a electron microscopy picture. So it's a very detailed microscopic image of a cell that actually has multiple chlamydia organisms living inside of it. Because this bacterial organism does not like to live out in the world. I mean, it will stay out in the world in a particular form, but it likes to live inside of cells. That's where it hangs out. That's where it does its damage. It lives inside of cells, so like mammalian cells, bird cells, reptile cells, other vertebrate cells. It has to stay inside of those cells because it has very specific energy needs that it only can get from living inside another cell of another organism. And it actually doesn't have the ability to move really well on its own, versus a lot of other bacteria. They have things like flagella that have, which are these little like projections on the bacteria cell that help them like move around and get to different places. But this particular organism can't do that. This organism doesn't have those features. This organism evolved to live inside of another bacterial or another organism's cell. Now, there's two stages of the organism. There's the elementary body and the reticulate body. The reticulate body, that's what's actually being shown in these pictures here. So this whole thing, if you guys can see my little pointer, this whole thing is a cell, and like this is a chlamydia organism, and this is a reticulate body. This is the intracellular form. It's living inside the cell in this reticulate body form. But when it wants to move on and go to other cells and replicate itself, and get into other organisms and inhabit new cells, then it has to transform into its infectious form, and that is called the elementary body. Now, as we kind of just briefly mentioned at the start of this, chlamydia does go by other names. So chlamydia psittaci is the specific infectious disease that causes the illness known as chlamydiosis or psittacosis, ornithosis, or parrot fever. If you hear any of those, chlamydiosis, psittacosis, ornithosis, parrot fever, all of those are caused by the same organism, and that bacterial organism is chlamydia psittaci. It's just, over the years of understanding this organism, it's just gotten different names from different communities. In the pet parrot world, we'll often say psittacosis because, well, that's just what the pet parrot world says. It means psittacine, it means parrot, right? And it's this disease that you see in parrots. Ornithosis is typically the name that is used more in the human world, because it is something that, if you were to go to the doctor and you were to be found to have this particular organism, it would be going under the name ornithosis, or your doctor might say parrot fever, because again, it was something that was originally found in parrots to be a problem. Okay, so what does this organism do? How does it replicate? How does it actually move? Because I said it has to live inside of a cell. And in order for it to move to another cell, it has to change form. So I have a little diagram here. You can see the photo credit that I am giving credit to this photo. I did not create it. Some other great scientists did. That helps us understand what is actually going on with this organism. Okay, so remember we said the elementary body is that infectious stage. That's the stage that is outside of the body. It's outside of the host cell. And it is on the search, trying to find a new cell to move into. So this picture here, this is a cell of, let's say, a parrot. This is a single cell of a parrot. And this little red thing, that's the nucleus of the cell. This is the elementary body of the chlamydia organism. It finds that parrot cell and it attaches to it. What then happens is it actually will enter as we go in. Oh, here we go. Sorry, my little pointer is appearing and disappearing. So the elementary body ends up going inside of the cell by a process called endocytosis, which is basically where the cell of the parrot recognizes this thing is sitting on top of it, and it goes and it grabs around it and pulls it inside of the cell. Now, this is typically, the elementary bodies are typically going to be attaching to cells that are on mucous membranes. So like the oral cavity, the eyes, the nasal passages, those are the places that it kind of likes to target. And it gets to the very superficial cells called the epithelial cells of those parts of the body. It also will sometimes get onto a particular type of inflammatory cell. It likes what's called a macrophage. So it gets on these cells, the cells sort of engulf it and pull it in. Now, the reason that happens is because normally the parrot cell developed this process of endocytosis to pull things in, and it will actually fuse this structure that it pulled in with other structures within the cell that will end up killing the organism. But the chlamydia organism has unfortunately evolved to figure out how to avoid that process, where you don't have fusion of what's called the endosome, which is the elementary body inside of the cell. It doesn't fuse with the lysosome, which is the thing that would normally like kill the bacteria inside. It actually has the ability to stop that process, which is really amazing that that has evolved. The parrot cell evolved the ability to have its own mechanism to kill bacteria, but then the bacteria evolved a mechanism to say, I don't care what you're going to do, parrot cell, I am going to live on, and I'm going to live on inside of you. So what happens is it then just safely sits inside the cell, inside that little vacuole, inside that little endosome, and then it transforms from the elementary body, which you can see is represented as this sort of more brownish goldish appearance, to the reticulate body, which is the form that it wants to live in order to take up substances and get nutrients from the cell. And in this little cartoon image, it's pictured here as this little yellow guy. So it transformed from the elementary body into the reticulate body. It then takes up substances and nutrition from the cell. It's living inside of the cell, all nice and happy. And unbeknownst to the parrot cell, everything's going kind of fine. But then the reticulate body decides, you know what? I've been living inside of this great parrot cell. Everything is going fine. I need to reproduce, and I need to develop into more elementary bodies so that I can go find another cell to live inside of. So the reticulate body transforms into elementary bodies. They go under tons of divisions. It's called binary fission, to create tons and tons of these little chlamydia organisms, up to 100 to 500 individual little chlamydia psittacosis bacteria inside of a single parrot cell. And then what happens when they have reformed and reorganized themselves into these elementary bodies is that then those elementary bodies want to move on to another cell. So they have to get out of the parent cell in some way. And there's enzymes that are made by the reticulate body that causes the parent cell to lyse, which means like break open and release these new elementary bodies, so that those elementary bodies can go on to find another cell and start the whole process over again. So you took one single little elementary body, got inside of that parent cell, it replicated itself to 100 to 500 individual little cells, and now it's rupturing out and releasing all those elementary bodies out to get into other cells and do the exact same thing. And it does it over and over and over. So that's the life cycle of the chlamydia organism itself and how it is getting into cells. Now, how is the disease actually transmitted? So how does it move from one bird to another? Well, what happens is a bird is going to typically inhale or ingest those elementary bodies. So those little infectious bodies, they get either inhaled or they get consumed, and then it gets into the parrot that way. The chlamydia organism then replicates in different cells. And again, I mentioned it gets into the mucous membranes first, it gets into macrophages, but then it spreads around the body and it spreads to other places and affects other sites. And so it can replicate in the lungs, it replicates in the air sacs, it replicates in the pericardium. So the pericardium is actually this sac that's the heart sort of lies in. And it gets into those particular areas, the lungs, the air sacs, and the pericardium, within 24 hours after the bird has been infected. It then gets into the bloodstream within about 48 hours, and it can actually spread from one infected bird to another bird to infect another bird within 72 hours. So that's just 3 days. I mean, from the time a bird itself gets the infection to the time that it is able to spread it to someone else is just 3 days, which is pretty amazing that this little bacterial organism can replicate itself that quickly and get to a point where it is able to infect somebody else. Now, it travels throughout the body, so it takes different time points to get to different areas. Usually, it's not detected in the droppings, the feces, until about 10 days. And interestingly, usually the bird is actually infective to other birds before it starts to have onset of clinical signs. Just a couple of interesting notes about the organism. If the infection occurs by the respiratory tract, so it's inhaled, it gets into the respiratory system, then it's going to spread to the lungs and air sacs and other organs, resulting in sort of a more symptomatic problem, versus if the bird gets it by orally ingesting it, then it's going to get to the GI tract. And when it gets to the GI tract first, before it gets to the lungs and air sacs, then it's less likely to cause a symptomatic disease and may lead to more of a chronic disease state that's more asymptomatic. So that's interesting because it just, you may have two birds in a room that contracted the organism, but they present with different ways because one inhaled it and one ingested it. So, yes, this is a infectious disease that is certainly pretty infectious between birds and amongst birds, but the way that it presents is going to be variable, and it can be as simple as just how did the bird actually get it into its system. That is the main thing that tells how the process of disease is going to evolve and occur. Interestingly, we talk about the route of ingesting it or inhaling it. That is called horizontal transmission. So that means it's transmitting from one individual to the next individual by exiting the body, essentially. Vertical transmission is where you actually have transmission from parents to offspring. And this doesn't seem to be a major route in which the disease is transmitted, but it has been documented that it has actually transmitted this way in certain species, ducks, gulls, and budgies. Those are the species that it has at least been documented that it has been able to transmit from parents to offspring. But generally speaking, it's more the horizontal transmission route where birds are either inhaling it or ingesting it. Okay, so now, important question that needs to be addressed is, well, we know how it replicates, we know how it gets into the bird, but how does it really cause disease? Because, just because you have a bacterial organism in your body doesn't mean it's going to cause problems. Right now, all of us, we've got bacteria all over us. As much as you may hate to think about that, it's true. We have bacteria on our skin. We have bacteria in our oral cavity. It's in different parts of our body, and some of those organisms just coexist with us and everything's fine. There's bacteria on surfaces of different structures. It's all around. You can't get away from it. but why do certain ones cause disease, and how do they cause that disease? Specifically to chlamydia, the way that it's known to cause disease is one, just from that lysis from the cell. So we talked about its replication process and how it, when it wants to move on from one cell to another cell, and it goes into its elementary body state, from the reticulate body to the elementary body, that elementary body has to be released from the cell, and there are enzymes that are produced by the chlamydia organism that cause lysis or rupture of the cell. The organisms are able to get out, but now you've caused damage to that cell, and that cell, if it's severe lysis, that cell is going to die. Maybe if it's not severe lysis, maybe it is able to repair itself to some degree, but generally speaking, if that cell's ruptured open, the contents of the cell are released, and that cell is going to die. Other ways that chlamydia actually causes disease is there's actually a toxin on the outer membrane of the elementary body. So that toxin, just in and of itself, it's toxic. It's going to cause damage to different cells and surfaces and structures within the parrot's body. Interestingly, there are different strains, and some strains are more virulent than others. So virulent means how bad does it actually cause disease? You can have things that are less virulent, where, yes, they cause disease, but it's not too bad. It's minor. It's something that the body is able to compensate and repair itself from. Versus other chlamydia psittacosis strains are much higher virulence, so they are much more damaging, cause much more severe destruction, lysis, toxicity, and cause thus higher levels of cellular death, higher levels of signs, symptoms, and problems. So not all chlamydia psittacosis bacterial organisms are created the same, just like not all people are created the same, right? Like, we're all people, but we all have differences about us. Well, bacteria do too. They're not just these, every bacterial cell is the exact same. There's little differences even amongst the same species. So some are more virulent, some are less virulent. And then really important to know as well is that the host, meaning the parrot, their health status really plays a role in it as well. So, if we have a bird who has a really healthy, robust immune system that is really trying to fight things off, or has great abilities to, do appropriate cellular repair and regenerate new cells when cells have been damaged, or what have you, they just have they're really healthy. They may not have as bad of a problem from chlamydia if they get it, compared to, say, a bird that is suffering from multiple issues. If you have a bird who already has some underlying disease process going on, maybe it has some other type of bacterial infection, or maybe it has some organ damage, or maybe it has something like cytosine beak and feather disease, a virus that is causing it to be immunosuppressed, and then you put chlamydia on top of it, well, now you've just caused a lot more problems. And that individual who is not as robust with their immune system, is dealing with other problems, may have a lot more signs and symptoms from chlamydia than the individual who has a more robust, healthy immune system. Other things that we need to consider as well regarding the parrot is its age, because younger parrots, just like kids, don't have as great of an immune system. They may be a little bit more prone to having problems than if you have, a bird who's 3 or 4 years old and just has had a little bit more appropriate functioning immune system. Same thing with elderly birds. If you have an elderly bird, it may not have as good of an immune system, may not be able to deal with this as well. Okay, I'm touched on it a little bit, but just to go on it a little bit more, the incubation period. This is the time from when a disease or this infectious agent, the chlamydia organism, enters the body to the time that you actually start to see disease signs popping up. And that can be a bit variable in how long that actually will take. It could be just, a really short process because maybe you have a really virulent form of chlamydia, you have a really virulent strain of it, and it may be short, maybe like just 3 days, and you're starting to have problems. They got the infection, 3 days later, bam, they're starting to have signs. Or it could be something that's a prolonged, protracted thing. It could be several weeks down the road before you start to see signs. It could be months down the road. Again, it's going to go back to the strains, virulence. It's going to go back to what's the host's immune system, the parrot's own immune system doing, what is its health status like. Um, it's also, just going to be dependent sometimes on load, like how much chlamydia elementary bodies did they actually inhale. And then the other thing too is the route that we talked about. If it's inhaled, if it goes through the respiratory system, that's going to be more likely to cause a little bit more symptomatic disease versus if they ingest it. That's going to probably be a more protracted thing before you actually see signs. And some birds show disease without a known exposure, so maybe even longer than just weeks when it's in its chronic form. There is definitely a lot, of questions that we still have about this organism and how long can it actually sit in the body for, and be sort of in like a quiescent state, not really causing many problems before they end up breaking with it or having problems at some point. So once we know the incubation period from the time that they get it to the time that they start having signs, what are those signs? There's variable signs that you could potentially see in a bird that has chlamydia. The big sign that we often think about, and like me as a clinician, when I have a bird coming into the office and I am wondering, could this bird possibly have chlamydia, or, is this something that I need to worry about? One of the signs that I start to think about is respiratory, number one. If I have a bird that's coming in that's having signs of difficulty breathing, or maybe it has eye discharge or nasal discharge, or it's doing something like, coughing, like trying to bring something up that seems like it's coming from the respiratory system, or say I listen to its lungs and its lungs sound harsh. These are all respiratory signs that I may go, look, this bird is showing signs of a respiratory problem. Chlamydia is going to be one of the things that I'm going to think about. Of course, there's other things. There's other types of bacteria. There's aspergillosis, like we talked about before. There's mycobacteriosis. There's cardiovascular problems that could cause respiratory signs. So respiratory signs are not specific for chlamydia, but absolutely it is something I have to have on my list of differentials and possibilities that I need to think about when I have a bird presenting with respiratory signs. Is one of the things could be chlamydia. Next thing, gastrointestinal signs. Now, gastrointestinal signs are hard because there's so many different diseases and problems that can cause you to have gastrointestinal signs. As far as what those signs are, as you see, the first thing, reduced or absent appetite. Well, that's definitely not specific to chlamydia. I mean, like anything can cause a bird to have a reduced or absent appetite, whether it's something infectious, something metabolic, some organ isn't functioning well, some sort of trauma that happened. I mean, there's so many things that can make a bird have a poor appetite that, I have to say, when a bird comes in with a reduced appetite, chlamydia is not on the top of my mind. I'm thinking about, well, there's like 5 million things that could cause this bird to have a reduced appetite. And I need to look at other signs and symptoms, things on their physical exam that could key me into one system over another or one problem over another. But other signs we may see, regurgitation or vomiting. They may have this greenish loose stool. That's actually something that I feel like when I was in veterinary school was talked about a lot, was chlamydia can cause this really sort of lime green looking kind of droppings. And that can be because it, like, the feces themselves are sort of greenish, but also it can be because the urate, which is the white part of the droppings, that can turn a little greenish because the chlamydia organism is causing liver damage. And when it causes liver damage, if the liver isn't functioning appropriately, one of the signs that you may be able to see that indicates liver damage is going on is this greenish coloration to the urate in the dropping, which is normally the white part of the dropping. Neurologic disorders could also be present. They may have seizure activity or some sort of like little tremors. They may have torticollis. Torticollis, what that is where they're kind of like in this sort of contorted, like turning their head sort of to the side. It's not staying nice and like on symmetrical and like on midline. It's like really like twisted, torqued to the side, kind of curled. Sometimes you'll hear chicken owners saying something wry neck, which means kind of the neck is kind of off to the side. That's more scientifically called torticollis. Again, lots of other things can do that. Trauma, other infectious diseases, cancers, cardiovascular problems. But if I have a bird that's coming in with all three of those signs, if I have a bird that is showing respiratory signs, it's having ocular and nasal discharge, it's having greenish stools and urates, it's not eating great, and it's having some level of like neurologic signs, maybe like little twitches, difficulties walking, I absolutely am going to be thinking about chlamydia as a possibility, and I need to be testing for this. Now, of course, there's other just general signs, which we see in a lot of different diseases that are always frustrating. Lethargy, fluffed up feathers. Absolutely, just that fluffed bird that is so non-specific, but is so common. Dehydration. So they may just be dehydrated. Maybe they're losing weight, even despite sometimes eating okay, they may be losing weight. Unfortunately, sometimes they don't really show any signs at all. And they don't show any signs to let their owners know that there's anything wrong so that they can get to the vet, and they just are suddenly found dead. So that does sadly happen. Sometimes it's just sudden death. On the flip side, you can also have them have zero signs because they're more one of these chronic birds who has it that isn't having any problems from it. It's just sort of lying in wait, maybe waiting for them to get to the point where they have an immunocompromised system so that they can start to have more issues from it and see these signs later on. So how do we go about diagnosing chlamydia? Well, so like I said, if I have a bird that comes in and it's showing those various signs of respiratory signs, maybe some GI signs, plus or minus neurologic signs, maybe it's just respiratory and lethargic, and I want to see if chlamydia could potentially be causing its problems. A couple of things that I'm going to do initially that are sort of broad, because again, chlamydia is just one of the many things that can cause so many of the signs that I just mentioned, but there's many other things that cause those signs too. I'm going to probably be doing my basic CBC and chemistry, which is just basic blood work, and probably some sort of imaging studies. Now, a CBC, that's looking at your red cells, your white cells, and your platelets. A lot of times, but not always, you are going to see a CBC where the bird has high white blood cells. So the white blood cells are spiked. And in particular, one of the cells that you will see increased is the monocyte. Remember at the beginning where I said that when the elementary body is like looking for parrot cells, what kind of parrot cells it likes to get onto? It likes to get onto the epithelial cells and mucous membranes, but it also likes to get on monocytes or macrophages. Those are a type of inflammatory cell. So it's not uncommon that when you check a CBC, you see a monocytosis, so an increase in this particular white cell. Now, if I see that change, of course, I'm going to be thinking of chlamydia. Okay, it's higher on my list, but there's still other infectious diseases like aspergillosis or mycobacteriosis, which we have talked about in previous webinars, that could cause that exact same sort of CBC change. Chemistry panel, what I might find on there, I might find liver changes, I might find kidney changes. It really depends on where else in the body that chlamydia organism decided to cause problems. I have a picture here of some bird blood work. Now, the CBC unfortunately was cut off on this, but it shows the chemistry panel, and it shows what's called a protein electrophoresis. That's what this is down here, the EPH. It's EPH is just sort of the shorthand term for protein electrophoresis. What the protein electrophoresis does is it actually looks at different proteins in the blood. And there's two main proteins, albumin protein and globulin protein. Albumin protein is produced by the liver. Albumin is really important circulating in the blood, maintaining blood volume. The globulin proteins, those are proteins that are produced like in immune responses. So you have different types of globulin proteins, alpha, beta, and gamma globulins, and they may go up when the body is having an immune stimulation event occurring. And the body, when it recognizes that it has this chlamydia organism inside of it, if the body recognizes that and goes, hey, hold on, we do not want to have this infectious agent here, the body tries to do something about it. It sends out those monocytes, which are the inflammatory cells that are trying to engulf it and trying to kill it, and normally would, but chlamydia has evolved the ability to live inside of those monocytes, so that's unfortunate. But then also there are immunoglobulins that are being produced trying to like kill organisms, and that's manifested in your globulin proteins. Those are going to go up in blood. In particular, you're going to have an increase in your beta globulin. So I'm looking at this blood work. This is actually a real patient. This was a little cockatiel, and or not cockatiel, I'm sorry, it was a lovebird. It was a little lovebird, and we did blood work on it. It had some respiratory signs, a little bit of ocular nasal discharge. It was a little skinny, but it was still eating okay, maybe a little bit quiet, a little bit fluffed, no neurologic signs. The CBC, I didn't show it on here, but it didn't have anything exciting, so that case didn't help me. The chemistry panel, I'm looking at all these different values, and I'm not seeing anything like on the liver values. This is one of the liver values, AST, looks normal, everything's okay there. The potassium was a little bit low, but maybe that has just a slight electrolyte imbalance because he's just not feeling great. His muscle enzyme, that's what this is here, CPK, that's elevated, but that can happen just from the blood draw. So like that's also probably not too significant. But when we do the protein electrophoresis, we see that, oh, the beta globulins are up. And when I look at the beta globulin is at 1.1. And when I look at this reference range, it's only supposed to go up to 0.6. So that's kind of a pretty significant increase in the beta globulins. This bird's immune system is being stimulated by something. So I may then go on to do imaging, including radiographs to like look at the lungs, the air sacs. I may do CTs as well to get more detailed images of those particular areas. Or I may at that point want to go to the more specific diagnostic for chlamydia itself. So those were the broad diagnostics where I'm like casting a wide net, trying to see, because again, the signs can cover a whole bunch of different things. I am doing my CBC, chemistry, my EPH, maybe my radiographs. Those are big, broad diagnostics. I got some information from my EPH that said, you know what? In this particular little lovebird, you have an immune stimulation that is really causing your globulin proteins to go up. I need to think about things like chlamydia amongst other organisms as well. So we did a specific test on this bird. We did a chlamydia EVA. So it's an antibody, it detects the antibodies to chlamydia organism. There's 3 different types of tests you can do. Well, there's a little bit more than 3, but generally speaking, there's the PCR test, which actually looks for the organism itself. There are antibody tests where we're looking for antibodies that the bird is creating to the organism itself. And then there are antigen tests where we may be looking for other like parts and pieces essentially of the organism. So there's multiple different tests that are out there. But in this particular patient, we did the chlamydia EVA, and we found that that bird was positive for chlamydia. So depending upon how the bird presents, I may be doing different types of tests. And for anybody out there who's watching the webinar and learning more about this organism and maybe has concerns about it in their flock or anything like that, just wants to know more about it, I guess it's important to know that your veterinarian may do a different test than the EVA. They may do the PCR. They may do something called an IFA. There's different tests that are out there. And I will say, generally speaking, for like screening purposes, I'm often doing the PCR. This bird did have a PCR test as well. And after we got this antibody test showing it was positive, we did the PCR test, and it also came up as positive as well. So there's various tests out there. It's not just one. And your veterinarian may choose to do one or the other or a combination depending upon the individual and how they're presenting. Now, chlamydia is something that it's sometimes hard to find. So we have these tests the PCR, the ELISAs, all these different tests, but sometimes the tests come back a little bit inconclusive, which is always frustrating for owners, absolutely, for veterinarians, for sure. Veterinarians do not like to have, neither do owners, like to have sort of nebulous results where it's like, well, maybe it's a problem, maybe it's not. But sometimes, unfortunately, that does happen because this chlamydia organism, as you've seen, it can hide out inside of cells and not be exposed to the environment and live its life really happy inside of those parrot cells. And maybe we're testing for them, maybe we don't actually find it because there's no DNA of the organism out around because they're all hiding inside of cells. So, but if I have a bird that comes in that I'm really concerned about chlamydia, and maybe my testing isn't coming up really definitive, like, hey, you absolutely have chlamydia, I can still be suspicious for it and I can still treat them for it. Now, there's actually a because chlamydia is a disease that is a very important disease, and it is something that can affect people, which we're going to talk about in a moment. Over the years, people have come together to compile all the information we know about chlamydia into this nice little compendium. And every about 10 years or so, the compendium gets addressed and looked at to see what's new out there in the literature, what updated research do we have, how can we adjust the compendium to have all the updated information and provide this compendium to veterinarians, human doctors, and regular people to be a source for us to understand how to diagnose chlamydia, how to treat it, all of that. So in this compendium, they actually have 3 different levels of diagnosis. You can have a suspect case, a probable case, or a confirmed case. A suspect case is usually where we're seeing typical illness, like I talked about, respiratory signs, GI, neuroscience, and it has been linked to a confirmed case that has been tested. So maybe there's a bird that was positive on a test, it absolutely was confirmed to have chlamydia, and this bird was in contact with it, and now it's having signs and symptoms, then that is going to be a suspect case. Another suspect case is going to be when you have a bird that's acting totally fine, has no signs whatsoever, but you do those serology tests, look for antibodies, and it has high titers. So it's not having any problems from the particular infection, but its body is showing, well, actually, you're responding to organism being in here. So it's probably somewhere in here. You're not having any problems from it, but it's there. So that's a suspect case as well. And then also, kind of the more typical illness, when a bird has the typical signs of, respiratory, GI, what have you, and you put it on the typical therapies, which we'll go over in a moment, and they respond, that's a suspect case as well. You didn't do any testing to confirm it. You didn't do any testing that made it highly likely or probable, but it looked like chlamydia. You treated it like chlamydia. It responded appropriately. That's a suspect case. Probable cases are where they have a high titer after the onset of signs, or they have antigen, found by one of those tests, ELISA, PCR, immunofluorescent assay. See, I jumble words too, Laura. In the feces, in cloacal swabs, respiratory or ocular specimens. So like we find some stuff that's evidence of it. It probably has chlamydia. But to truly confirm it, there's various things that we can do. You can actually identify the chlamydia antigen, so like pieces of chlamydia organisms in tissues by doing this fluorescent antibody test. Now that is usually something that you may find that on a biopsy or on a post-mortem sample. So after a bird has passed away and samples are collected from tissue samples. You can also do a confirmation that a bird has chlamydia by doing serial titers. So basically, you collect a blood sample at day 1, and then 2 weeks later, you collect another titer blood level, and you compare them. And if you see this increase in titer from day 0 to day 14, that's a confirmed case because the body is responding. It's saying there is something in here. I am creating antibodies to the organism. I was at this low level. Now I'm at this high level. I'm only going to be creating antibodies if I'm actively being stimulated to create those antibodies. That is a confirmed case. Other ways we confirm it is not by the fluorescent antibody, but by doing special stains on tissues. Again, these are post-mortem things. Or sometimes you can actually identify the chlamydia psittaci from a clinical specimen, so swab samples, coughed up, exudate, that sort of thing. Okay, so what are the actual treatments? What treatments do we have available to us? Because thankfully, this is at least an organism that there are treatments available for. The most common treatment, the classical treatment, is doxycycline. And that doxycycline, depending upon the species, there's various ways you can provide it. There are doses for it being administered in the water, administered in the feed, or directly administered by mouth or by injection. So various routes of how you can actually, well, two routes, oral or injectable route, but various ways that you can get it in the food, the water, directly by a syringe, like this picture of a royal right here, taking a syringe of food. You know, various ways you can get that doxycycline into them. In the past, I forget exactly when it was. I'm going to say like probably like 15 years. There was studies that have been done that looked at azithromycin, because azithromycin is used more in people with chlamydia. And they have done studies now in cockatiels with azithromycin and found that that is also an effective treatment. Now, according to the compendium at this time, really it's just recommended for cockatiels, but it probably works for other species as well. It's just that studies have only been done in cockatiels so far. There's also our fluoroquinolone antibiotics, enrofloxacin being the most common one, but there's also other types of fluoroquinolones. Those types of antibiotics, they will get chlamydia, they'll kill chlamydia, but they don't allow the body to get completely rid of chlamydia. So yes, they do treat it, but no, they're not recommended for getting rid of the chlamydia infection. You need to be on doxycycline or azithromycin, have the bird on doxycycline or azithromycin to truly treat chlamydia psittaci in a parrot. Now, there's various possible outcomes when you treat them. They may have complete resolution with treatment. Great, that's what we're going for. That's perfect. That's what we want. But they may also go on to have chronic infections if they're not treated with an appropriate antibiotic. So they do get put on enrofloxacin. We know that enrofloxacin isn't going to clear it. Their signs and symptoms got better. Maybe the owner didn't, have the ability to test this bird. The bird was showing signs and symptoms. It had chlamydia, but we didn't test it to confirm that it has chlamydia. It got put on enrofloxacin. It got better. Life's great for the bird for the moment, but we didn't clear the organism, and now we've gone into a chronic infection stage. Other things that can happen, sometimes you get chronic organ changes. If that organism caused a lot of damage to the liver, well, you may have some chronic liver problems. And sadly, the last thing, of course, is they can pass away from it. Chlamydia does have the ability to cause death, unfortunately. Okay, other important thing for us to talk about is we really focus, of course, mostly on the birds, because that's what these webinars are about, is about birds, right? But this particular organism is one that is zoonotic. And we've talked about zoonoses before, but if you haven't watched some previous webinars, what zoonotic disease is, it's an infectious disease that can spread from animals to humans. So animals have the infection and they can give it to people. And chlamydia is absolutely one of those. Chlamydia psittaci can be spread from a parrot or another bird, because I'm really heavily focusing on parrots, but actually there are other species of birds. I did mention like the ducks, as well for a moment, but other species of birds have been found to get chlamydia. So it's not just parrots that get it. It's just that parrots are like the most common one that we see with it, but absolutely has been diagnosed in many other species of birds as well. So when people pick up this organism from a bird, what signs do they have? Because when we think about people and chlamydia, we think about, again, other types of chlamydia infections. But chlamydia psittaci, when a person picks up chlamydia psittaci from a parrot, they're going to have respiratory signs, conjunctivitis. It's really kind of like a bad cold. They can have headaches, muscle aches, chills. And if the individual is elderly, if they're young, if they're immunocompromised in some way, then they may have much more severe signs. And people can even have pretty nasty signs, just like the birds. We talked about how the birds can have it affect their liver. Same thing with people. It can affect the liver in people. We talked about how when it first gets into the bird, it replicates in the lungs and goes to the pericardium as well. Lungs, air sacs, and the pericardium. The pericardium is that sac around the heart. It can affect the heart in humans. It can affect the brain. It can cause splenomegaly, make the spleen get big. So there are lots of nasty things that can happen when people pick up chlamydia. But again, it goes back to the same thing that we talked about with parrots, where, if you have a good immune system, you may not really have some of those real severe signs. Just I'll tell you, I do know of a veterinarian who did pick up chlamydia psittacosis from a parrot working with them. And they had a very bad cold-like symptoms, respiratory signs, conjunctivitis, fever. But then they got on medications and did okay. They didn't have all the real serious side effects that can happen. Because this is such an important disease, not only for our parrots and then being like chronic carriers possibly, and maybe shedding it, but not having problems themselves, and they could spread it around, they could give it to people, it's a zoonotic disease. This is something that we really have to talk about prevention as well. And in order to prevent this disease, usually it is recommended that any new birds coming into your flock, into your home, be tested for chlamydia. I mean, I have a personal rule in my house. Every time I get a new bird, you're going to get tested for chlamydia before you are allowed to enter the home, because I want to make sure I'm keeping my flock safe. Anytime I have an owner come in with a new bird, I am recommending they test it for chlamydia before they introduce it to their flock, or even if they don't have another flock, just for their own health, knowing that they don't have a bird that has chlamydia. Other thing that's important to do, quarantining birds for 30 to 45 days, because the way that the chlamydia psittacosis organism like replicates, and even though it can replicate really fast and pop out of a cell, cause lysis and infect another cell and very rapidly, sometimes it does that more slowly. Particularly when it gets into macrophages. When it gets into a macrophage, that inflammatory cell that we talked about, that's going to have a longer lifespan. Sometimes it'll hang out in that macrophage for a while, and the macrophage actually needs to go through its natural process of dying before it releases those reticulate bodies to go on to infect other cells. And so that quarantine period is of 30 to 45 days is recommended, because we're trying to give time for more of those chronic cases that may show absolutely no signs and be seeming to be okay, like to try to catch any little signs or symptoms that could be popping up in that period. It's also not a bad idea to periodically screen birds, especially if they leave the home. If you have a bird that's leaving the home with some frequency around other birds, it does not hurt at all to just periodically do some screening. Because I'm a veterinarian, I got to tell you, with my own birds, I do periodic screening. Like everybody new coming in, yes, they get tested, but then periodically I test here and there, because I'm the potential source for problems for them as well, because I'm working with all different types of birds all the time. So I could potentially bring something home inappropriately. Even though I'm washing my hands and like changing clothes and all that sort of stuff, I'm doing the best I can with biosecurity. I still think, for me personally, that it's important that I do a little bit of screening every once in a while, just to make sure I didn't do something silly and bring something in the home. Okay, so that is the end of everything that I had for you guys about this talk. Any questions that anybody has?
Okay, let's see. Waiting for, I think, yeah, we do. Just a real quick question for you. So if you were to go into your doctor's office, do you need to like request a specific, like, would random, like you're as a human going in for blood panel, will it show this on there? Like, would your doctor alert you to it?
Well, it wouldn't show on like a regular CBC chemistry panel, just like on our birds when we do a CBC in chemistry, just a general blood panel. It's not going to show on there, but it
Yeah.
might show signs on there that go, you could potentially have something. So you do need to specifically ask for it, or you need to specifically test for the organism. And that's again going to be through whether there's like antibody tests, antigen tests, or like looking for the DNA of the organism. There's various ways that we test for it in birds. Same thing with people. Various ways it can be tested for in people.
Okay. I was just thinking, so maybe like you have to be proactive with your own doctor if you think you might have been exposed to it, right? And say, can you test
Absolutely.
this with my.
Yeah, absolutely. And I will tell you, the one veterinarian that I knew who had it, she was proactive with her doctor. She was like, "Hey, I'm having all these respiratory signs. I feel like I've got this bad headache. I've got a fever. I'm not doing great. I also work, as a veterinarian. I'm around different infectious diseases. I work with parrots. Could I possibly have psittacosis, ornithosis, and then they tested her for it and found it that way.
Okay. So real quick, we have a question from Heidi, who's a volunteer at a parrot rescue, and they're concerned about potential exposure. You kind of touched upon this a minute ago, with their home flock. So they always change their shoes and clothes and shower when they come home. Is that the best they can do for protection? Also, how can one be sure that a bird is not infected when adopting one from a rescue if the disease can lay dormant? So,
So kind of, yeah, back to that prevention thing. So you're doing the best that you can when you wash your hands, you change your clothes, you change your shoes. That's practicing good biosecurity. Trying to make it so that you don't have anything on you that you could bring to your birds. Um, but then random screening, I think I don't think is wrong at all, just to do random screening. And the screening test usually is a PCR test, is a swab of the eye, the mouth, the butt, because those are the places where it's shed from. And so just a little swab, it's not invasive, and checking that way. And then as far as getting a new parrot from a rescue, well, it's recommended any parrots going into a rescue where they're going to be around a lot of other birds that they get tested. And I have to say, I think most rescues that I've worked with are doing that. Hopefully, they're doing it. If it's a newer rescue that's like starting up and doesn't know exactly what they should do, highly recommended that you at least have birds going into a rescue tested for chlamydia, because you mix a whole bunch of birds together. It's a great breeding ground for different infections.
okay, okay. Question from Lori about what is the mechanism of vertical transmission from parent to chick? Is it present in the egg, and does it happen through feeding? What's the vertical transmission from parent to
So
chick?
yeah, so I believe the because the feeding would still be considered horizontal transmission, even if it's from parent to chick, it would be still considered horizontal if it is going from mouth to mouth. So vertical is more like it's in the a reproductive system itself. So like whether it's in the sperm, the egg, in the reproductive tract in some way, like it may be up in the oviduct, and like when the um, fertilized ovum is moving down the oviduct and getting the different layers of the egg formed around it, might be put on in the egg in some fashion in that way.
Okay. Oh, and then we have a question from Hani in Qatar. Does it matter if the bird is living outdoors or indoors in terms of having a higher risk in catching it? And what are the chances? Does regional environment, temperature play a role in disease, like hot, cold, tropical countries? Do you see it?
Yeah.
Or
Well, okay, as far as the temperature goes, and regional environment, I don't know that I can really answer that one well. I haven't really heard about that being necessarily studied. So I don't think that it plays much of a role, but I'm not 100% certain about that. Regarding a bird living inside versus outside, well, it depends on where you live a little bit, because outside there could be exposure to wild birds, and wild birds could potentially carry the organism. And again, it's not just parrots that carry this. Parrots are like the big one, but other pigeons and doves can carry this for sure. In fact, so for me living here, I live in Arizona, and we have a wild lovebird population that isn't supposed to be here, but it's here. And they're great. They're really cute. But that population of lovebirds out here in Arizona, they have psittacosis. They also have citizen beak and feather disease virus, and it goes through like fluctuations from year to year. So some years it's really low numbers, and some years it's bad. Some years there's a high levels of problems, and birds unfortunately die from it. And so there was a study that was done about 10 years ago out in Arizona where they like mist netted a whole bunch of birds, wild birds, caught them, and were testing them to see like who in this population has chlamydia. Um, and I forget the exact percentages, but the lovebirds had a pretty high percentage, but the pigeons and doves were coming up not too far behind the lovebirds. So pigeons and doves are everywhere, right? And so if you have an outdoor aviary, it's important to try to prevent any wild birds from being able to get into the aviary, having some sort of barriers that prevent those wild birds that could potentially be carriers from being able to get to your birds, and shedding it and spreading it.
okay. What if you maintain wild bird feeders that attracts pigeons and doves and wild birds that have it? Should you be, is there any, I mean, you can't really, I mean, if you're feeling if you like let's say you're replenishing like a bird bath or water or
Yeah.
seed that you'll
Well,
leave out. Do you,
yes, I mean it could get there. And so that's I mean, I feed wild birds too. So I know that I'm having a little bit of a risk, but I feed the wild birds. So personally, what I do with my birds, because I take my birds outside a lot. I don't have an outdoor aviary, but I do have an outdoor space where I take my birds out. And I have that space netted off so that, like, I'm trying to prevent wild birds from getting in there as best as I possibly can. Um, Occasionally a pigeon or a dove has gotten into that spot, and I need to like reinforce an area like so that nobody can get in. But I feed birds, like wild birds, when I feed them, that's in my front yard. My parrots go in my backyard. The wild birds are in the front yard as best I can keep wild birds in a space. So feeding and everything is up front. If I'm doing any sort of like putting out new food into the feeders or into my little waterer thing or dealing with the hummingbird feeder, whatever, all of that, I'm dealing with that when my birds are inside, they are in their cages, like they're doing their own thing, and I am able to focus on doing like cleaning and changing and restocking the food. So, and I can wash my hands. I'm more mindful of washing my hands and stuff, and when they're not around and making sure I'm not touching things inappropriately. So you do the best you can to have good biosecurity of your pet population on one side and your wild population on the other.
okay, yeah, that's good advice there. Question, let's say probably the last question of the day is Bob wanted to know what is the most common symptom of chlamydia in a green cheek conure? Is there
Probably
like
respiratory. I would say respiratory for any species really is going to, and any species of parrot is going to be number one. And when I say respiratory, I involve conjunctivitis associated with that. So inflammation of the pink part around the eye, a little bit of ocular discharge, nasal discharge. Those are going to be your like top most common sign that you're going to see.
okay. Wow. Dr. Lamb, once again, thanks. I mean, your PowerPoints just help really solidify the information for people. And someone said earlier how you can take such a complex topic and make it so that we can kind of digest it on our end. So totally appreciate that.
Oh,
Um,
happy to.
so I got to announce today's winner. Our giveaway winner is going to get the apple berries, and I saw the Arroyo video of him tasting that. That was adorable on the Instagram for
Yes.
Lafeber. Yeah, so it's Arroyo tested and Arroyo approved. um,
Mhm.
the apple berries. And by the way, I think they're just here for the rest of this month, so they're the limited edition flavors, and that is going to go out to Marilyn Graff, as well as another Lafeber item of your bird's choosing. And I got another announcement. So next Friday we'll be on with Dr. Tolley with an episode of Ask the Vet. And then big announcement. Blah, blah, blah. In August, I'll be seeing you again, Dr. Lamb, because we'll be kind
Yep.
of together on our 200th webinar. We're going to be celebrating our 200th episode, which is bonkers. Like that's
Yeah.
just right. Because
It's
you were
amazing.
on with you were the first person that we had on. So it's only appropriate. You would be kind of having a big presence in this 200th celebration. So we'll be kind of yeah, it'll be fun. And we're gonna have some uh it's just you got to join us because we're gonna have announcements, a big announcement, a big product announcement is we're gonna unveil it on our 200th episode, August 8th, as well as we'll have some giveaways. So please join us. You're the ones, people who are here today, everyone who comes to these webinars, you're the reason why we have them. So 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 join us August 8th for our 200th episode. And Dr. Lamb, I mean, you've been here with us. My gosh, how many years have we been doing this? Like a while. So
Gosh, it was 2020 when we started, I think, right?
yeah, yeah, that's just awesome. Okay. Our library of webinar recordings is getting larger and larger by every Friday. So if you missed one of our webinars, you can always go back and watch them. And this is one that's probably going back worth rewinding so you can really grasp hold of the knowledge that you gave us today with the PowerPoint. So thanks, Dr. Lamb. Appreciate
Yeah.
it. Awesome webinar, and we'll see you guys next time. All the best to you and your flock. Take care. Have a fabulous weekend, everybody. Bye.
Bye.